So in today's video, we will discuss the anatomical, dynamic and potential territories in flap planning. So it is very important for us to know these territories because they tell us when to delay a flap, when not to delay a flap, and they also help us in effective planning. So as we all know, Cormack and Lamberty have described these three territories, and for the sake of convenience, we will discuss them in a case of a DP flap. Now I've taken this Arnold's chest for the ease of understanding the anatomical landmarks in a better way. So as always, we begin with marking of the important anatomical landmarks. So when it comes to DP flap, we have the inferior border of clavicle. Then here we have the deltopectoral groove. You can appreciate the cephalic vein entering into the deltopectoral groove. Then we have the perforators of the internal mammary artery. These are the parasternal perforators. I would say somewhere around 1.5 to 2 centimeters from the sternum, lateral border of the sternum. Then in the deltopectoral groove, we have cutaneous perforators of the thoracoacromial artery. More commonly, it is a single perforator. It can be multiple perforators as well. As we go beyond that, we have the cutaneous branches over the deltoid, which are supplied by the deltoid branch of the thoracoacromial or the anterior circumflex humeral artery. So this was about the blood supply in these three areas over the DP flap territory. Now these are the perforators of the internal mammary artery.